Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, we're going to be doing another Kahoot, and we're going to be covering preeclampsia. This is going to be part 2. If you haven't watched part 1 already, that's fine. It really doesn't go in order, but I would encourage you to go back and watch part 1 after you watch this video. If you are a current nursing student or you've already graduated, but you're studying for your boards, this covers a lot of important content that you absolutely need to know about preeclampsia. So I encourage you to watch both of them. If you haven't already checked out my other social media platforms, such as TikTok, Instagram, Facebook, of course, here, YouTube, my handle is the same everywhere. Be sure to check it out, Nexus Nursing. Now, on TikTok, Instagram, Facebook, I have a lot of shorter videos. It's really, surface level learning, quick learning. Here on YouTube, my videos are a lot longer. I go in depth, but I've got lots of great content on my other social media platforms that you really won't find too much of on YouTube. And I've got lots of stuff on YouTube you don't find on the other social media platforms. So I encourage you to check me out on all platforms. Be sure to check out my website, nexusnursinginstitute.com. I have plenty of resources there available for you. You can sign up for Next Generation NCLEX session. I have 2 parts. Part 1, I teach you how to think. I go over priority. I go over delegation. I go over important wording and phrases that you may see, and I explain to you what it means, what the test writer's looking for you. And then in part 2, we actually go over examples of test questions, concepts that you need to know and understand. So be sure to check that out. And my calendar is now open for September. I'm not sure how many spots are available, but I've opened it. So if you want some private one-on-one tutoring, be sure to check it out. Anything that you find open, go ahead and take it. Even if it's not the exact date or time that you want, you can keep checking to see if something opens up, then you can reschedule. But I encourage you to take whatever you can find because my calendar does book very quickly. All right, guys, without any further ado, let's get started. Preeclampsia part 2. First question. All right, the type of preeclampsia that involves liver dysfunction, hemolysis, elevated liver enzymes, and platelet count, what is it called? Gestational hypertension, preeclampsia, eclampsia, HELLP syndrome. Those are your choices. If you're taking maternity right now or you're about to take maternity, I guarantee you better know this, okay? What is the name of the type of preeclampsia that involves a liver dysfunction, hemolysis, elevated liver enzymes, a low platelet count? Very good. Very good. HELLP syndrome. Liver dysfunction, also known as what? Hepatic dysfunction. That's your H. Hemolysis, breaking down of those blood cells. Elevated liver enzymes. Liver's in trouble. Those enzymes are going to be elevated. EST, ALT, low platelet count. Platelets are important for what? Clotting, right? Low platelet count. The patient's going to be at risk for what? Bleeding out. HELLP syndrome. Very good. Now let's talk about the other choices. We have gestational hypertension. This is hypertension during pregnancy. Here's the thing. No protein in the urine, right? Once there's protein in the urine, once there's hypertension, once it's been 20 weeks or more of gestation, that's what? Preeclampsia. That's your key going from gestational hypertension to preeclampsia, that protein in the urine, right? And of course, graduating from preeclampsia to eclampsia is what? Yes, hypertension. Yes, protein in the urine. Yes, it being more than 20 weeks gestation. But what are we adding to it? Seizures or even coma, eclampsia. All right, guys, if you are studying for NCLEX or you're taking maternity right now, you absolutely need to know the difference between gestational hypertension, preeclampsia, eclampsia, and HELLP syndrome. You got to know what each of those involve, okay? Can you please try to fit the whole screen in the camera? I thought, is this better, guys? All right, next screen. True or false? HELLP syndrome appears to occur most frequently in African American women. Is this true or is this false? HELP syndrome appears to occur most frequently in Black women. Is this true or is this false? Wow. 75 of you guys said true. And I get it because when it comes to a lot of these health issues, we do see a lot of it happen in African Americans. However, when we're talking about HELP syndrome, it's actually false. We see HELP syndrome more in Caucasian women. Okay, make sure you know that. Select all that applies. Most women with HELP syndrome report which symptoms? Select all that apply. Here are your options. Let me go ahead and move this. Malaise, flu-like symptoms, epigastric pain, right upper quadri-abdominal pain, hypotension, restlessness. What are the signs and symptoms we not expect to see, but women with HELP syndrome report? Malaise, influenza-like symptoms, epigastric pain, right upper quadri-abdominal pain, hypotension, restlessness. The first four. Malaise, just that general feeling of not feeling well, just feeling sick, feeling weak. Influenza-like symptoms, fever, weakness, epigastric pain, feeling heartburn, right upper quadri-abdominal pain. Not hypotension. If anything, we'd expect to see what? Hypertension and not restlessness. They're going to feel malaise. They're going to feel weak. They're not going to be restless, wanting to run all over the place. Okay. The game pin to get in is 852 3631. 852 3631. All right, type in your answer. Low dose blank has been found to reduce preeclampsia and adverse outcomes in selected high-risk women. So not everybody, not everyone that's pregnant, but selected high-risk women, low-dose blank has been found to reduce preeclampsia and adverse outcomes. What is the blank? Type in your answer. Low-dose what? What do you think we're talking about? Low dose blank has been found to reduce preeclampsia and adverse outcome in selected high risk women. Come on, there's over 100 people in the room. I need more people answering. Magnesium, heparin, insulin, calcium. Let me move this. Aspirin. Only 37 people had the correct answer. Low dose aspirin. Low dose aspirin has been found to reduce preeclampsia and adverse outcomes in selected high risk women. So, speaking of that, let's see who is high risk. I think that's my next question. Yep. Who's at high risk for preeclampsia? Select all that applies. Who is at high risk for preeclampsia? Here are your choices. Having a history of preeclampsia, multifetal gestation, history of chronic hypertension, history of diabetes, type 1 or type 2, having kidney disease, or having an autoimmune disorder. Select all that apply. Who is at high risk for developing preeclampsia? All of them. Having a history of preeclampsia places you at risk for having preeclampsia this pregnancy. Multi-fetal gestation, that means having more than one fetus in the womb, twins, triplets, more, I always forget, four, triplets, three, what's four called? Quadruplets, I think. Anyway, you get it. History of chronic hypertension. So being hypertensive before you even were pregnant, right? So we're not talking about gestational hypertension, having hypertension even before. Being diabetic, a type 1 or type 2. Having kidney disease or an autoimmune disorder, such as lupus. All of those places you at high risk for preeclampsia. Now, let me go back real quick. The last question where we were talking about the low dose aspirin for high risk women, that low dose aspirin, typically you expect it to be given between 12 to 28 weeks of gestation, okay? That's important to know. I didn't want to forget to tell you that. Professor D, I can't completely see the choices. Okay, do you want me to zoom in with the camera or move the camera back? Tell me on the live, guys. Should I move the camera closer or back? Because from what I'm seeing, I can see all the choices. Move back. Okay, zoom out. Let me see if I can zoom out. Oop. All right. How about that? Is this better? Okay. Okay, let's put this in order, guys. Order deep tendon reflexes from least active to most active. So take your mouse and put it in order if you are on the Kahoot. If you're not, just type your answer on the live. Order the deep tendon reflexes from least active to most active. You're welcome. Thank you for all the birthday wishes. Thank you. Anyone ask? I'm 21. Thank you. Only 15 got this correct. Okay, from least active to most active. I only had 4 slots, so I wasn't able to actually put the least active, which is 0, right? That's the least active. That's where there's no response whatsoever. So 0 is no response. And then +1 would be this one, sluggish or diminished. +2, that is your expected response. That is good. That is what we actually want to see. +3 would be slightly hyperactive. I forgot to put an E on the end. Hyperactive. And then +4, that is your brisk. That is your hyperactive response. Okay. So it goes from 0 to +4. But again, there was no space for me to put the 0. But 0 would have been no response at all. That's the worst. And then +4 is the most active response. That is brisk. Okay. True or false? The presence of edema is included in the definition of preeclampsia. True or false? So for the healthcare provider to diagnose the patient as having preeclampsia, edema must be present. Is this true or is this false? Thank you. $43 said true. This is something very important. I guarantee you, as a nursing student, if you're in the nursing program right now, you're taking maternity, you're going to have a question on this. I guarantee you. It may be worded differently, but this is something you absolutely need to know because you got to know this for NCLEX. All right. Edema is not included in the definition of preeclampsia. So for a patient to be diagnosed with preeclampsia, the presence of edema is not considered. Now, are we going to assess our patients for edema? Absolutely. That's important. However, it is not considered in the diagnosis of preeclampsia. What is considered? Again, hypertension, being 20 weeks or more in gestation, and protein being present in the urine. Those three factors. Okay. Edema is not one of them. Now I can't speak. Ugh. Let's talk about edema before I move on to my next screen. So when you're assessing your patient for edema, if that patient is ambulatory, they're allowed to walk around, they're not bedbound, they're active, where do you expect to see the most amount of edema? You expect to see, what's it called? Dependent edema. So you'd expect to see, or you'd assess for edema where in their feet. But if that patient is bedbound, where would you expect to see the edema? In the sacral area? You need to know that, okay? Next question. The presence of proteinuria is ideally determined by evaluation of what? Would it be blood smear? Would it be a 24-hour urine specimen? Would it be a urine dipstick? Or would it be urine glucose testing? So remember, proteinuria has to be present in preeclampsia. Well, the presence of proteinuria, how is that what is the preferred method of determining proteinuria? Thank you, Lamont. I'm so happy I did this Kahoot because you guys are acting a hot mess right now. Urine dipstick, absolutely not. And if you choose on your test, you're going to get it wrong. It's 24-hour urine specimen. Now, because the 24-hour urine specimen, that is diagnostic of proteinuria, not dipstick. You see urine dipstick, I think you guys have this confused as students, so let me clear that up right now. Urine dipstick, that's what you're going to have your patient do at home. You're going to teach them how to check the urine at home, but not for diagnostic evaluation. Absolutely not. Presence of proteinuria, it's going to be 24-hour urine specimen. Okay. Now, what we're going to look for is 300 or more milligrams when we're evaluating for proteinuria. It has to be 300 milligrams or more, the concentration. It's going to be either that or protein creatinine of 0.3, one or both. That's how it's determined from the 24-hour urine specimen. Carol Chef said, damn, we really are a hot mess. Yes, you guys are, but guess what? That's a good thing because I want you guys to make your mistakes right now with me so you get the correct answer on the test. Next question. Select all that apply. What are the severe features of preeclampsia that should be reported immediately? You're going to teach your patient to report immediately, or you as a nurse, if you note this in your patient, you're going to report that to the healthcare provider immediately. Here are the options: severe headache, epigastric pain, right upper quadrant abdominal pain, scotoma, blurred vision, double vision. What are the severe features of preeclampsia that should be reported immediately? Select all that applies. Correct, RN Nicole. That's how important this is. On the last Kahoot I did for preeclampsia part 1, this information was on there. I just worded it differently, but that's how important this is for you guys to know. You guys will see this as a question. I'm telling you. You got to know it. Jessie Lynn, I'm going to wring your neck. All of them. All of them. Everyone should have chosen severe headache. My goodness, I put the word severe in front of headache. If a patient has anything severely, it needs to be reported. Not only preeclampsia, anything that's severe, you better report. Why would you not choose that as an answer? That was a dead giveaway. Epigastric pain, right upper quadrant abdominal pain, and I forget who that student was on the live, whoever said everything except for scotoma. Are you kidding me? So scotoma, that's a type of visual disturbance. You see scotoma, you see blurred vision, and you see double vision. Why in the world would you say everything except for scotoma? So you're going to go with blurred vision, which is something wrong with the vision. You're going to go with double vision, which is something wrong with the vision, but you're not going to go with scotoma? What kind of sense does that make? Guys, these are the kind of tricks that you need to use when you're answering questions. If you're going to choose two other types of visual disturbances, why would you leave out the third? If you're going to go with it, go with it. Oh, you had no idea what that was. Oh, okay. All right, fair enough. Fair enough. It's a type of visual disturbance where part of the visual field is misconstrued is not the word I'm looking for, but I can't think of the word I'm looking for in my brain, but part of the visual field, part of what you're seeing is not clear. That's what it means, okay? All right, true or false? The hammer is being held loosely between the thumb and index finger. Is the hammer being held correctly? Let me tell you something. If you're in the nursing program and your school uses HESI, this is a HESI question. You better know this. And NCLEX asks this as well. So, it may be described to you or you may get the picture of it. Either way, you got to know this. If the hammer is being held loosely between the thumb and the index finger, which is what they're doing below, is that hammer being held correctly? What are they doing? They're checking for deep tendon reflexes. True or false? The correct answer is true, and it was close. 22 of you guys chose false. If you are studying for your boards or your school uses HESI, you better review this. It's a question. You need to know it. On HESI, they show an illustration. So they have four different illustration of the healthcare provider or the nurse holding the hammer, and they ask you which one is the correct held correctly. And on NCLEX, you get a description of it. From what I've been told, because I haven't seen NCLEX, I don't write the question, so I'm just giving you feedback that's been given to me before I'm accused of anything. All right, select all that applies. What are important patient teaching for preeclampsia? What are important things to teach your patient with preeclampsia? Select all that apply. Here are your choices. Always sit to take your blood pressure. Report any increase in blood pressure immediately. Dipstick your clean cat urine as ordered to assess for proteinuria. Report to your healthcare provider if proteinuria is 1 plus or you experience decreased urine output. Repeat decreased fetal movement activity. Keep a daily log or diary of your blood pressure readings to bring to every prenatal visit. Those are your options. Select all that apply. What are you going to teach your patient that has preeclampsia? The code to get in is 852-3631. 852-3631. Very good. Oh, you guys are learning. Yes. All of these are teaching points. And this has been seen as select all that apply and also as a bow tie on NCLEX, on the next generation NCLEX. So make sure you know these teaching points. If you're currently taking maternity, you better know this. Don't say I didn't warn you. If I'm going too fast, all of my Kahoots, guys, you can find them on my YouTube channel. After we do the live Kahoot, give me an hour to edit and get it posted on my YouTube channel. And just go to my Kahoots playlist on YouTube, and you can watch this as many times as you need to. You can pause, take notes, whatever you guys got to do, okay? Someone, R.N. Nicole says, the word always threw me off, but I understand now why. I'm happy you said that, R. Nicole, because if you've been following me for a long time or any amount of time, you know I teach you about that word always. If you don't know what the answer is, you have no idea, stay away from all inclusive. Stay away from words such as always, never, only. We stay away from those type of words. However, nursing is not cookie cutter, right? We use critical thinking. So there are some situations where you'll see the word always in the answer choice, and that is the correct answer, right? And I don't even know which answer choice did I have that said always. I don't see always here. Oh, always sit to yes. So there are some times where that is going to be your answer. This is one of them. You're going to teach them to always sit down to take their blood pressure. You're going to teach them to take their blood pressure using the same arm, preferably the right arm. You're going to tell them to report any increase in blood pressure. Any increase in blood pressure is significant in that patient that already has preeclampsia. You're going to teach them, if they're at home, they're the ones checking their urine for protein. They're going to be doing dipstick. You're going to teach them that. You're going to teach them to report if it's +1 or higher, or if there's any change, if there's a decrease in the urine output. Remember, we need at least, at a minimum, 30 milliliters per hour for urine output. You're going to teach them to report decrease in fetal movement activity. What do I mean by that? 4 or less than an hour. That needs to be reported. 4 or less than an hour needs to be reported. And of course, keep track of the blood pressure and bring that diary or that log to every prenatal visit. All right, women with severe gestational hypertension or preeclampsia that with severe features, they should be hospitalized and placed on what? Calcium gluconate, magnesium sulfate, potassium chloride, or prenatal vitamins. So if a patient has severe gestational hypertension or they have preeclampsia with severe features, they're going to have to be hospitalized and placed on which drug? Calcium gluconate, magnesium sulfate, potassium chloride, or prenatal vitamins. Very good. Magnesium sulfate. Now, something important, and I talked about this in part one. I'm going to reiterate it because I'm telling you, it's going to be a test question some way, somehow. If you're taking maternity right now, you need to understand that. The reason they are getting the magnesium sulfate is to prevent that patient from going into seizures. Okay. Magnesium sulfate causes muscle relaxation. Now, a side effect of magnesium sulfate is bringing down the blood pressure. That's wonderful because this patient with severe hypertension, the blood pressure is up. Or if they have preeclampsia with severe features, the blood pressure is up. So that's wonderful. Yes, we want to bring down the blood pressure, but that is not the indication for magnesium sulfate. Please listen to me. We have so many better drugs on the market to bring down the blood pressure without the adverse effects of magnesium sulfate. We will never give magnesium sulfate as an indication for hypertension. If we're giving magnesium sulfate in the case of gestational hypertension or preeclampsia, it is to prevent seizure activity or coma. It is not to bring down the blood pressure. A wonderful side effect of the magnesium sulfate is to bring down that blood pressure, which is wonderful, but it's never an indication. Do you hear what I'm saying to you? All right. Don't say I didn't warn you. Type in your answer. Which drug should you expect to be ordered to enhance fetal lung maturation for gestation of 34 weeks or less? Or less than 34 weeks. So the gestational maturation is less than 34 weeks. What drug are you going to give, do you expect to give to enhance the fetal lung maturity? Because why? We need that fetus to be able to survive outside of the womb if mom has to go into labor prematurely. What do you expect to be given? You know what? There is an answer. That's my fault. The obvious one, I didn't put it as an option. You guys are going to be so mad at me. It's not here as an option, but I'm going to say it. I'm so upset with myself. I just saw it on the live. I can't believe I did that. Love answers. I'm going to wring your neck. I know you did not just type that in as an answer. I should put surfactant in. But this it is corticosteroids, betamethasone, dexamethasone, corticosteroids. Let me see what you guys put. Good, 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 good. Oh, yeah, I did have less than 34 weeks. Okay. Okay. All right. I was worried for a second. Someone said folic acid. Are you kidding me? Folic acid, we give folic acid, guys, not for lung maturation. We give folic acid because we want to make sure that fetus doesn't develop what? Tell me on the live, what is it that we want to make sure the fetus does not develop? That's why we're giving the folic acid. It starts with an N. Very good, Melanin Mama 22, neural tube defects. That's what we're trying to avoid. Last question. Select all that applies. What's the question? All right. Immediate birth is indicated if any of the following complications are present. So if any of the following complications are present, mom has to go into labor immediately. Immediate birth is indicated. If any of the following are present, select all that applies. Here are your options. Imminent or actual eclampsia, uncontrollable severe hypertension, pulmonary edema, placental abruption, DIC, or fetal demise. I can't remember what DIC stands for. Disseminated something coagulation. What does the I stand for? Anyone know? Tell me in the live. I can't remember for the life of me. Intravascular. Thank you. I had a brain fart. Okay, let's take a look. And the correct answer is all of them. If any of these occur, immediate birth. Okay? So imminent or actual eclampsia. Mom actually goes into seizures or a coma. If that uncontrollable severe hypertension, keyword, uncontrollable. That means we've done everything that evidence-based practice has shown us to do that should bring down that blood pressure, and we're still unable to do it. Uncontrollable, severe hypertension. Yep, you got to go into labor. Because what is the only cure to preeclampsia? Giving birth, getting rid of that, getting rid of, oh my gosh, what's the sac called? I need to get out of vacation mode. I go back to work in what? A week. My brain's not working, but you guys know what I'm talking about. Pulmonary edema, placental abruption, by the way, that's a medical emergency within itself. DIC, and of course, fetal demise. Any of these happen, immediate birth is indicated. Thank you, delivery of the placenta. I can't remember the word placenta. Any of these happen, immediate birth is indicated. All right, guys, you guys did relatively wonderful. So let's see who won the Kahoot. If you guys are watching on YouTube, don't forget to check out my other social media platforms such as TikTok, Instagram, and Facebook. Listen, on TikTok, Instagram, and Facebook, that is where I have my short videos, very passive learning. It's not in depth, it's not deep. But here on YouTube, if you really want to learn, that's where you go. That's where my videos are about 30, 45 minutes long, and I have the time to explain the content. My handle is the same everywhere, Nexus Nursing. And on my website, Nexus Nursing Institute, that's where you can sign up for a private tutoring session with me, one-on-one, private tutoring session. I book very quickly. So if you want private tutoring from me, if you find a spot, take it, because I guarantee you go use the restroom and you come back, it's going to be taken. You can sign up for an NCLEX review with me, part 1 up, part 2. My website is nexusnursinginstitute.com, so be sure to check that out. All right, guys, let's see how you did.